Hi, it's Dr. Mike. Today's video is entitled Fibromyalgia, Diagnosis of Exclusion. And what we'll discuss in this video is basically, I'll just be explaining this concept. And at the end, you'll be able to tell exactly why they use this phrase with fibromyalgia. So, first off, please note that this presentation is not intended to provide individual patient advice, but rather it's a way of providing education about fibromyalgia. And if you think you have a condition that's causing you chronic pain, please talk to your doctor and get a proper diagnosis and treatment. So, fibromyalgia is considered a diagnosis of exclusion. To understand that a little bit better, you need to know a little bit about fibromyalgia. That said, the primary symptoms of fibromyalgia are widespread pain or tenderness in muscles, joints or skin from touch or pressure, severe fatigue and often sleep difficulties, waking unrefreshed as an example, and then memory difficulties or cognitive issues leading to fogginess, inability to concentrate, and memory issues. So those are the four main symptoms of fibromyalgia. And what you need to understand is that when you go to see a doctor or a therapist or someone like that, and you present with these kinds of symptoms, there could be a whole lot of different things that could be causing those symptoms. So the process becomes about trying to differentiate or distinguish exactly what is causing this. So often we will talk about possible primary conditions or causative conditions which could be causing these symptoms. And these are diseases that commonly cause the same symptoms as fibromyalgia. For example, rheumatoid arthritis, chronic fatigue syndrome, Lyme disease, and different kinds of infections, and also lupus, which is an autoimmune disease, chronic Epstein-Barr viral infections, post-traumatic stress syndrome, and thyroid problems. So these are just examples of conditions that could also give you the same kinds of symptoms as fibromyalgia. But for a lot of these conditions, there are tests that they can do to diagnose these. So for instance, in rheumatoid arthritis, you have a blood test that comes back positive for a certain blood marker that is diagnostic for rheumatoid arthritis, meaning it proves that you have it. The same thing with lupus. They have these specific auto antibodies in your blood that comes up that is typical or characteristic of the disease. What complicates things a little bit is that sometimes you have comorbidities or overlapping conditions, meaning that you could have more than one thing happening at the same time as fibromyalgia. For instance, irritable bowel syndrome, restless leg syndrome, skin sensitivities and rashes, dry eye and mouth, or Sjogren's syndrome, which is also a kind of immune syndrome, and then tinnitus or ringing in the ears, migraines, irritable bladder, or jaw problems. And all of this kind of adds to the mix of possible questions that the therapist or doctor has to figure out when they're trying to find out whether you have fibromyalgia or not. So a lot of the times they will basically work through a diagnostic process to determine what you could have. So they'll send you for some tests. As such, there isn't really a specific test for fibromyalgia, no generally accepted test. So what that means is it's a diagnosis of exclusion, meaning once that they've done a whole lot of tests and excluded the other diseases, like the ones I mentioned, what they're inevitably left with afterwards is the diagnosis of fibromyalgia. And that's why they call it a diagnosis of exclusion. So as you could imagine, this could take some time to figure out because you might have to go for a whole lot of tests before you have excluded a whole lot of possibilities. which could take years in certain people. So they generally diagnose fibromyalgia on a group of diagnostic criteria. And when they do use blood tests, those are used to figure out whether there are other diseases that could cause symptoms or be happening at the same time as fibromyalgia. That's why these tests are done. And then if they do suspect that, it could be laboratory tests, blood tests, imaging being x-rays, MRIs, CTs, ultrasounds, or any other kind of test that they might need. And then sometimes they might give you a diagnosis of a primary or a second fibromyalgia, but that all depends on who you're seeing and how they kind of see it. So anyway, I hope that answered your question about explain the concept of fibromyalgia being a diagnosis of exclusion. So my next video in the series is called Fibromyalgia Criteria, and we go a little bit deeper into the diagnostic criteria of fibromyalgia. There is a 10-part series on fibromyalgia, a little mini course that I've put together. If you want, there should be information in the description or in the comment section. Please feel free to comment or like this video or subscribe to the channel if you found it useful. And I hope to see you in the next video.